Yes. Hi, everyone. It's nice to talk to you. We are addressing the European Union, but also addressing our leaders. I'm Arthur Nyango.
And I'm Jephter.
We are going to address these two category of stakeholders on why they need to invest and why we need to work hard to ensure that mental health is respected, protected, and fulfilled as a right of everyone. First of all, we can begin from our history. Where do we come from? We come from a history where mental health and culture are intertwined and interwoven, which means everything mental health was looked from a cultural perspective. If you had a mental health condition, it was considered kind of a taboo, like you are paying for someone's sins or you are paying for your own sins. And also from genetic angle, you could inherit a mental health condition from your great grandparents, but it would be because of a sin that they committed, so it would be incumbent on your family to chase away the spirit. And apart from that,
Yes.
it's gradually being accepted that there are other social factors like stress that can also lead to mental health conditions. But it is still not fully embraced, because when this happens, you realize that it is still handled from the religious point of perspective or the traditional point of view, where it is seen that a demon has to be removed out of you, or
Cleansing has to be done.
yes, cleansing has to be done.
Cleansing has to be
So
done.
that is basically talking about stigma.
Yeah, well, thank you. Oh, yeah. That comes to stigma now. Stigma has got to do with seeing a person or excluding a person from other activities.
Yeah.
You see a person as a kind of a lower level than you.
Yes.
Why? Because this person has got a condition that is a mental health illness.
And it's not their fault.
It's not, yeah, it's not their fault. It's not their wish to be born that way. Now when the aspect of stigma, now the aspect of stigma has brought a lot and has added a lot of stress to people who by chance get themselves mentally affected. Now, for example, you remember cases of young children being tied up in homes. They're not given opportunity to come out and play with others. They're not given they're not given the basic right to education. Yeah. And then most of them, okay, like most people with kind of diverse or too much handicapping conditions in the brain, they're taken as people are mad, and people are very vocal and can beat people up, and some of them end up being imprisoned.
That is true. And also, apart from that, just looking at their families, you realize that they don't even participate in matters of their family.
Yes.
You realize that even land inheriting, and even issue as pertinent to them as their own health,
Yes.
that is a decision that now has to be made by another person, even when they think they can make the decision for themselves.
Yeah.
So it is really, really a challenge.
And they're not even given opportunity to maybe come in meetings that maybe for the community and help make decisions, or rather their illness or their incapability or their handicap condition is what is looked at in this case.
And the worst part of it is, even those people who have recovered from mental health conditions are still considered to be suffering from mental health conditions. For instance, once you suffer from a mental health condition, you are glued to it to an extent that people do not respect your ideas. So that is the situation culturally where we are. So that's why we really need to have to look at treatment. What happens in terms of treatment? Usually, people access treatment when it is very late for two reasons. The first reason is that mental health conditions are stigmatized, so people will ignore them until it is too late, and the person is complicated and now probably comorbid with other conditions.
Yes.
So that happens. Another reason why this happens is a person is detected to be mentally ill and then taken for treatment in traditional setting, where they're taken for prayers and also maybe to a witch doctor for removal of a spirit. So you realize that when they get to the hospital finally, they are very ill and probably complicated, and also they have been traumatized by the mode of treatment that they were being given. And thirdly, we also look at our system, our model of deciding what access care. We use a binary model where we use Diagnostic and Statistical Manual 5, DSM-5,
Yeah.
and also we use International Classification of Disease Revision 11, ICD-11, both of which are binary. And what does this mean? You have to meet a certain set criteria for you to be considered to be having a mental health condition,
Okay.
to receive certain kind of treatment.
Yeah.
And to on top of this, to add salt to all this injury is that when you finally know exactly you are sick and maybe you are from a village, you find it very hard to access mental health services because they are scarce, they are not accessible to everyone. So that is the powder keg of the situation that we are dealing with in Kenya.
Well, thank you for that. Now, it is important to note, or it is important to check or get track of a mental health illness when it is still at an early stage.
Yeah, or even before it happens.
Or before it happens, for easy management and treatment.
Yeah.
Well, now that now brings us back to prevention part of it.
Yes.
Yeah. Now, prevention. In prevention, I think it is very nice, or it is very good to note that most of the non-governmental organizations in Kenya that are in the health sector and other stakeholders have really put in more effort to prevent mental health illnesses as compared to the government that has not maybe financially invested much, but then has got a concern about that. Yeah, I think it's there's the case of Kisumu County.
Yeah, Kisumu County has really been supportive, and actually a lot of effort, I also believe, has been done towards ensuring that there is access to mental health. Yes. Kisumu County, in terms of talking about prevention and also education of community, we are also looking at how the government officials are also being reached.
Yes.
We realize that Kisumu County has invested 1 million Kenya in the last financial year. This financial year, I may not be sure, but in the last financial year, invested 1 million Kenya shillings, which it invested for a population of 1.5 million people, which means per capita, every person has less than a shilling for mental health.
Yes.
So if I try to cost it in terms of euros or in terms of dollars, it would be hard to talk about.
And pathetic.
It is important to note that that is something. It's a lot of money from the basic fact that it was not there before. But we are calling on the government to really increase investment.
To increase.
And what about educating the communities also?
Yeah, that is important. Making people to know about mental health.
Yes.
I think that is also very crucial in prevention part of it. Yes. Now, when I make you know something, you cannot prevent what you don't know. Yeah. So you can only prevent something that you already know and you already have the symptoms and the signs. When you see this, so you can come in and prevent that before it actually happens. Now, majorly, I think most of the non-organization call them the non-organization, the non-governmental organizations, that's so to say. I think they have really sensitized our people to some extent. Nationally, village level, and they do seminars, they work to health facilities, they educate them on 1, 2, 3. So that is also important, making people know the signs, the symptoms of a mental health illness, and that is good for prevention or maybe even treatment strategy kind of.
Yeah, also in terms of prevention and advocacy and also all that, the government has really done a good thing. The national government over the last 10 years has been putting a lot of effort. Back in 2012, the government started reflecting on the Mental Health Act of 1989, which was backward. And just the other day, this year, in the month of June, the government actually launched the amendment, not the government, the parliament.
The parliament,
actually passed the amendment bill, so it is waiting assent of the government, of the president.
That is for mental health,
yes. And also going back to 2015, the government developed the mental health policy 2015-2030. Yes. So that has really pushed a lot of stuff, including the development of mental health action plan that actually pushed for the development of the mental health amendment bill, and that has really been powerful.
And it's been wild.
And it has really been powerful. So what is really remaining for us as a country is, and also as investors looking at investing in mental health in Kenya, we need to invest in mental health at the county level. What will this do? it will enable the domestication of the policies so that they come
yeah.
at the county level. Apart from
Yes.
domestication of the policies, the implementation of those policies, because health is actually devolved, and health,
Health aid is a devolved function of that is from the national government to the county government.
yeah,
Yes,
so
yeah.
the national government will not come and plan and even pay healthcare providers. So
Yes.
for us to have the change that is really required, for the action, for the rubber to meet the road,
Yeah.
it has, the next investment in advocacy has to go to the county level.
Yeah,
And therefore we call on the European Union and even our national governments to invest in supporting the development of domesticated policies and also the implementation of the domesticated policies.
Thank you, Ada. Now, to the European Union and maybe to the globe, or to my country, to my village, we need to know that mental health is on the rise everywhere.
Yes.
And we also need to connote that mental health the well-being of somebody's mind is a basic human right.
Yes,
And that should be
everyone
taken.
deserves to be well.
Yeah. And then now the only advice that I can give maybe to governments or any other bodies, just investment in mental health. I think that will go a good way helping us. Otherwise, thank you for.
Yes, we
Yes,
therefore
thank you.
call on you to invest in mental
Invest
health,
in mental health.
ensure that everyone can access mental health. And thank you. See you next time when you've invested in mental health at the community level. Thank you.
Thank you, Ada. Yeah.